The coronavirus has been met with a series of purported help, at-home tests, and even cures for COVID-19 have found their way from one social media account to another. What's true and what's not? We separate fact from fiction with Andrew Lover, UMass Amherst Assistant Professor of Epidemiology.
Certainly, the rapid progression of cases globally and in the U.S. is very concerning for everyone involved in public health campaigns right now.
Yeah, and as you're watching those numbers, are you comparing them to previous either epidemics or pandemics? I mean, I think back from 2003 to 2014, we had MERS, SARS, H1N1. There was a number of very significant health problems over the course of that decade. Are you comparing, contrasting? How's it working?
Certainly, both of those. The MERS has been fairly isolated, and SARS was able to be controlled fairly well in a few months. And this is just of a completely different magnitude. We've gone from literally a handful of cases in central China in early January to at least 400,000 cases in just since then. So this is a major pandemic.
I think one of the things on many people's minds is there a way that we can slow or stop this in the form of a cure? I've heard some reporting recently that a combination of hydroxychloroquine and azithromycin could be used to treat and cure COVID-19. What do you think about that as an approach?
Yeah, right now there's really not enough data to say if it's effective or not. There was a very small trial run in France that had some problems in terms of the implementation, and so there's a bit of hesitancy about those results. But the WHO right now is coordinating a large set of clinical trials to get good data as quickly as possible.
So it's more of a wait and see as far as you're concerned in terms of cure or treatment.
Correct. Yeah.
And as people are hearing information like that, this is a cure, this is a surefire cure out of France, where would you direct people to be paying attention to for solid, reliable, fact-based information?
Definitely the CDC website, and then the Mass Department of Public Health is doing a fantastic job of putting really easily navigatable and fact-based information out. So those would be my two top choices, certainly.
As you've been watching and observing COVID-19, and as you pointed out the rapid spread of it, we've seen state and even local governments stepping up to say, these things, we're going to take these measures to preserve public health, closings, et cetera. And the federal government response was a bit slower. As you look back at some of those other disease problems that we discussed, is it typical that local and state governments take action before federal government, or is that a divergence from what we typically see?
Usually national governments are the ones that are more likely to set the national or major policies. But because this epidemic so far in the U.S. has been very regionally based, so Washington and Seattle have had a large number of cases, as well as California and New York. Those states have really decided that they are comfortable taking more aggressive stances sooner. But all of these social distancing and other options have, fairly significant social and economic and political impacts. So those have to be weighed against the pure public health.
For you, I mean, obviously your interest is in public health. How do you think that the response has been from a public health perspective?
It's definitely the rollout of the tests was a bit slower than we had all hoped. And then the testing rates in most states have been kind of under what we would hope for. But I think almost all of those problems have been solved pretty well. And that's the first major step to understanding what towns and areas within cities have the most case burdens.
In regard to that testing, as you said, that adjustment has been made, and obviously, hindsight in these situations is always 20/20, right? So it's not from a critical point of view. It's just drawing baselines and comparisons for people, I think. For you, as you look back on other public health crises or epidemics or pandemics, are there best case practices that we could be drawing from the past to help us here today?
It's a bit of a challenge because every epidemic is different. And the really challenging thing about this epidemic is we really have very little data. With influenza, we have decades and decades of good experience in terms of how to plan care in hospitals, as well as community level control measures. But with COVID-19, it's all brand new. So we're using the data from just a few months really to try and plan. So that's part of the reason that it's been more challenging than otherwise.
From the planning perspective, I'll have us pivot and talk about some myth busting, perhaps.
Certainly.
There have been a few things flying around on social media that I'd love to have you address, just because they've shown up in my feed so many times. So one, well, curious actually, let me start with, what's the biggest myth that you've heard reported?
There's been a lot of discussion if you can hold your breath for 10 seconds or some other time period, then you don't have COVID-19. And that's very definitely not the case. There's really no simple home-based tests available.
Which, if it were, would have been great news, right? Since there's been such a slow rollout in the testing. Thanks for addressing that one, because I certainly have seen that quite often. And another that I've seen in that thread is purported from Japanese Japanese doctors who treated COVID-19, and they suggest drinking liquid frequently, because the theory is that then flushes the virus down into your stomach, and stomach acid can eradicate the virus. What do you think about that?
Yeah, unfortunately, that's also not the case. Certainly staying hydrated is very important if you're running a fever. So there's a grain of truth there, but in terms of actually impacting the virus itself, that is not going to be helpful.
And I think the third piece that I've seen many, many times on social media is attributing to Dean Koontz, the author who had written about Wuhan 400, this concept in a book that he had previously published. So the idea that he either predicted this or has pointed to the fact that we can see more and more of these types of health problems coming from this area of China. Is there any suggestion that that's true?
Certainly, both the first SARS virus and this new virus are from bats. And so, the more interaction people have with bats and other wildlife, the more likely this sort of thing is going to happen. But I think a lot of countries are taking pretty aggressive steps to curtail wildlife in markets, which should certainly have an impact.
Is it fair to say it's unfair to point to one area as the problem area?
Correct. Yeah, it's a global problem, certainly.
And I think the last piece, there's the concept of this idea that herd immunity could be something that could address COVID-19. Can you explain what herd immunity is as a concept and what your thoughts are about that?
Certainly. So herd immunity is when a given number of people in a population have had the disease and recovered, and then they can't transmit. So if you have enough of those people kind of buffering everyone else, transmission just naturally stops. And this is how all the standard childhood vaccines work. With COVID-19, we really have no information about what kind of immunity you'll have after having an infection. So it's possible that herd immunity will be important, but we simply don't know. And we won't know for quite some time.
So in the meantime, what would you suggest to people in terms of making sure, as they're listening and paying attention to these issues, how would you direct their focus?
The most important thing to do is follow your state stay-at-home guidance. And that really cuts down on the number of times anyone interacts with anyone else, which is when transmission is likely to happen. And the key thing there is it protects everyone in the community. That's the most important one. And then definitely try and avoid hoarding any face masks, because hospital workers and first responders are going to desperately need those. Yeah, and then definitely follow CDC and Department of Public Health websites for best information.